our goal is to help in a country like Trinidad and Tobago with less than 2 million people. We can be the healthiest country in the whole Caribbean.
Hi, everyone. This is Trinbago Diaspora Outreach Network, and we have another episode of TDON Vignettes. Yes, previously you would have seen us chatting with Trinbagonians who are now domiciled in Canada. We had a previous conversation with another doctor domiciled in Delaware. And today, our third vignette features another medical professional, heart surgeon, Dr. Daniel Beckles. So he's guesting with us today. As you know, the program is Reach Trinbago Diaspora Outreach Network, based in Trinidad and Tobago, focusing on spotlighting the work of the diaspora. And we are going to be doing that at this time with another very significant interview with this goodly gentleman, Dr. Daniel Beckles. Welcome, Dr. Daniel Beckles.
Thank you so much for this opportunity. And, this has been a very humbling experience to be invited to get this award. I value what you guys are doing at the TDON and keep up the great work.
Yes, of course, we first must find out about your origins. I know you are from the Southland, but could you just give us a quick indication of your birth, schooling, and the circumstances that led you to move out of TNT?
So I was born in humble beginnings in Pleasantville, San Fernando, second of 4 siblings. I attended St. Paul's Anglican School and then went to St. Benedict's College for my O-levels. And then I started A-levels at Pleasantville Senior Comprehensive School. At age of 17, my parents migrated to Long Island in New York, and there you go.
So tell me a little bit about your early schooling or how you adapted to living in the United States at this time. So just give us a little background about your educational experiences, and that would be very useful for us to get a sense of some of the work you have continued to do since that time.
Yeah, so it was very difficult leaving friends behind, very close friends, my family, cousins, uncles and aunts. And so it was at first a little bit depressing, but I was with my immediate family, so that was great. But I channeled most of these emotions into my studies. So I got my bachelor's in biochemistry within 3 years. I got my my master's in chemistry, then went on to get my medical degree. And I even got a PhD degree in molecular biology. And then once I decided to do cardiac surgery, I went for training in Texas. And then I was at the Brigham and Women's Hospital up in Harvard for a year. So I didn't let anything stop me or hold me back. Pretty much take it on full speed ahead and got all the degrees done to become a very skilled and accomplished surgeon.
Well, accomplished is certainly you. And what I have noted is that you've been provided with several awards, and you are also a fellow of certain institutes. Could you quickly tell us what these fellowships are like and how do they at least impact what you do from day to day?
Absolutely. So medicine or surgery is a lifelong field. And so we have to keep our certifications up to date. Every 10 years, we have to get recertified. And so one can join different national and international organizations. So I'm part of a lot of those organizations. I'm a fellow of the American College of Surgeons. I'm a fellow of the American College of Cardiology, and I'm boarded in general surgery and in cardiothoracic surgery. So I'm double fellowship boarded.
Now, of all the awards you have received, just give us an indication of what award is very dear to you from all your accolades over the years.
You know, it really boils down to helping other people. And those are not in any title. It's basically in how we make other people feel. And so I pride myself in clinical excellence. When I have a patient every day, and they are doing great. It's just their evaluation saying that they've had the best care ever, and they have seen many doctors before they saw me. I think that is the biggest reward, is when patients are so satisfied that they give you a 5-star rating.
All right. And I note that you had been honored by Caribbean Life or Carib Life. Could you tell us a little bit about what was in focus there? When was that award issued, and what was it all about?
So I've had many awards over my years of practice, and these awards are basically people nominating you, some of your peers, some of your other doctors, um, other fellow doctors that we work with, and they actually recommend that we get these awards. And that's truly an honor when another doctor says, this is the doctor I would go to if I was sick. And so some of those awards um, were given to me in Texas when I was practicing there for 5 years. And then the Caribbean Life Award is in New York itself. When I was there for about 4 years, I was there practicing in my old alma mater. And so I think it was a group of something like 35 doctors, and I was one of them. So very privileged and very honored to be honored by them.
Dr. Beckles, in terms of your association with Homeland, having become such an accomplished person, what attracted you to do things from your homeland? And just give us a sense of the early effort you made to associate with Homeland when you were out there in the United States.
I think a lot of people leave Trinidad and they really don't want to even come back to Trinidad for some reason. I'm the opposite. I left Trinidad thinking I was always going to come back, and so Trinidad is very dear to me. And so every opportunity to come back to help in any way. So back after I finished all my training and I was in my first job, I got my license, my Trinidad and Tobago license since 2009 with the Trinidad and Tobago Medical Board. And I always have my license since, so I can come and practice in Trinidad. And so the early stages were just coming down and working with other cardiac surgery groups. And the group that was welcoming at that time was the West Shore group. And I worked for 1 week with them, volunteered my time, and at Port of Spain General Hospital doing open heart surgeries. And that was 2009. The next project after that was in 2012, when I worked with the Minister of Health for about a month, trying to put together what a national cardiovascular program would look like, taking care of patients in all 5 RHAs from Tobago and the other 4 RHAs in Trinidad, and putting together that plan to take care of I would say, one of the most sickest and critical illnesses is when you have heart disease. So those were the 2 early projects that I helped with.
Now, so at this time, you were doing institutional programs in Trinidad, as you mentioned, the Port of Spain General Hospital, being able to assist there for 1 month. What was the impact you had or observed in terms of your effort to do this? How much of a gap did you see existing between what was available and what you delivered? And how do you think Trinidad and Tobago has been able to progress to improve the whole delivery of that level of healthcare in the subsequent years?
So I spent 1 week, not 1 month, 1 week with the Port of Spain General Hospital team working through West Shore. And that's a very good point. It's all about observing. I think that they're doing a very good job right now. They have 3 centers in Trinidad, 1 in San Fernando, 2 up north that actually do open heart surgery. And looking at it from the outside in, we're able to see what are some of their challenges. And you have very skilled, doctors doing great work. But my goal is always to look and see how we can be more efficient and how we can get those services to the masses, to more people, not just a limited few. Heart disease is still the #1 cause of why people die in Western civilization. And starting with screening, prevention, and then going through and giving excellence in care. I think that's really what it's all about. So I think they're doing a good job, but there's always room to do better. That's my philosophy. And so that's why we work closely with the Minister of Health and come up with a plan of what's going to work, not for me, but what can work in Trinidad itself to make them into a national excellence or even the best in the Caribbean. That's the goal.
Now, in terms of your broader philanthropic efforts or charitable efforts, could you speak a little more about what you've been doing beyond that institutional support in recent years?
So in giving back, it's not about fundraising. I joined the TPA, the Trinidad Progressive Association, and as you know, these are critical, platforms, I think, that offer people like me who really want to give back. And so when I met, the previous president, Mr. Stephen Isaac, who's president of the Trinidad Progressive Association in New York, and I was introduced to TPA, I look at that as a true organization that you can actually join and give back to your home country. So it was like a pipeline that I then totally embraced. The way I was doing it was just coming down and working with groups. I didn't think that was working out well. But coming and being a representative of these bigger organizations that's been around for 3 and 4 decades, I think have a lot more, stability, structure to it. And so I used that. Number one, in 2018, I joined, and then I started to give scholarships to students through that platform and through that organization, just a way of, giving back. My first medical mission trip, joining them on their 10th, I think it was their 10th mission trip. It was phenomenal. That was my first mission trip, and it was outstanding. But I just keep looking at ways that we can do more and leverage technology and education and what the people really need. And of course, COVID hit after that, so we had a cancellation. I went to a mission trip in Guyana, and then last year we came down there and we impacted 3,000 lives on that mission trip in 2024, in combination with the mission trip people that I went to in Guyana, the APC group. So always looking for ways to make the biggest impact when we decide to do something like that.
Okay, so I want to go a little deeper into the scholarships that you were able to organize. What impact you were able to create, and who were the people targeted for these scholarships that were issued?
So I have to say that the scholarships are one way of actually giving back. We have a scholarship committee that would then put out emails and social media content to attract people. And it varies from field to field. Most of these people, some of them are in the pre-med, and most of them were in the pre-nursing field. And so they wanted to continue advancing their nursing degree. The last scholarship we gave was just doing our gala this year. And again, it was to a student who was traveling abroad to do a sabbatical abroad for a month, and the money came in really handy. So it's really about the needs of the people locally in New York that apply for these scholarships, and we're able to help them in any way we can. But more than scholarships, I just want to say fundraising is just, okay, so we can fundraise for money, but we really try to do some sort of hope raising, inspiration raising in people. And so giving them the money is one thing, but we put them into a mentoring program that we can then help them to be among like-minded people, success-driven people, progressive people. And that's really what helps more than the scholarship. The scholarship is just the little bait to get people who are interested, but the real scholarship is really in the mentoring that we provide.
All right, and before we close, it's important for us to talk a little bit more about your 2024 exercise conducted in Trinidad and Tobago. I think you said it attracted thousands of people, and I was able to see some of that actually happening. Could you tell us what was your biggest takeaway from having come in and perform your procedures in Trinidad and Tobago during the event last year? I think it was about 13 or 14 days you were here. Give me a
That's
little
correct.
of what's transpired.
That's correct. Again, this is the first time we collaborated with the APC group, which is the other grassroots from Guyana. And more than 3,000 people were impacted. 800 had dental work done, 200 had fillings done. There were 280, almost 300 extractions that had to be done, cleaning, x-rays, all these things. So dental was a big piece of it. To see that, people are not taking care of simple habits and simple things was really eye-opening. 900 people had health screening, which included, things like blood pressure, vision, hearing, blood sugar, looking at A1C, lung capacity, etc. We did HIV testing, cardiovascular counseling. So the numbers go on and on. What I have come away from that is that I think when you look at health, we have this theme that we're bringing on now that health is wealth. And without health, we're nothing. Okay, so we have to really put a focus now, and the TPA is really focused on people's health. Just making a simple change in 3 or 4 behavioral habits can really extend your life by 20 to 30 years. And that's what science is showing. And that's really what we're going to be pushing. So we learn a lot in terms of what is missing and where the gaps are. And in simple behavioral things like dental health and overall diabetes health, high blood pressure, too much sugar in the diet, it's just wreaking havoc on people's lives. And our aim in a big way is not to help one person at a time. Our goal is to help in a country like Trinidad and Tobago with less than 2 million people. We can be the healthiest country in the whole Caribbean, but we have to set that as our goal, and we hope to help with that.
Well, this is fantastic. We are appreciative of all that you have been doing and continue to do for Trinidad and Tobago. And you are truly deserving of this year's Diaspora Patriot Awards. And we certainly look forward to having you on the podium October 18th when we roll out the second edition of Diaspora Patriot Awards. Folks, this has been the third element of TDON Vignettes. And you have just been introduced to the work of Dr. Daniel Beckles, who resides in Texas, is part of the Trinidad Progressive Association. As a matter of fact, he's the current president. And in this circumstance, we know that we would be able to continue to call on them as partners in the service to the TNT population at home. Thank you so much. Continue to view this program. We have another episode coming up in another week or so. Over and out.